Hello and welcome, viewers. Today we delve into a critical topic in cardiovascular medicine, the choice between two common procedures for treating coronary artery disease, coronary artery bypass grafting, CABG, and stent placement. We're going to take a deep dive into what coronary artery disease is, how it affects the heart, and the intricacies of its treatment options. Coronary artery disease, commonly referred to as CAD, is a condition where the blood vessels that supply our hearts with oxygen and nutrients get narrowed or blocked due to a buildup of plaque. This can lead to symptoms like chest pain, shortness of breath, and in severe cases, heart attacks. To combat this, two common procedures are used: coronary artery bypass grafting, often abbreviated as CABG, and stent placement. Both of these treatments have proven to be quite effective, however, they function in distinct ways. In the minutes that follow, we'll explore these procedures, shedding light on how they work, their effectiveness, risks, and recovery periods. Stay tuned as we unravel the complexities of cardiovascular health and treatment. Coronary artery bypass grafting, or CABG, involves creating new routes for blood to flow to the heart by bypassing the blocked arteries with grafts from other blood vessels in the body. This surgical procedure is somewhat akin to constructing a detour route around a roadblock, ensuring that traffic, or in this case blood, can continue to flow freely. Surgeons typically use veins from the patient's leg or artery from the chest or wrist to create these bypass grafts. This method is particularly effective for those with severe blockages or multiple narrowings in the coronary arteries. Following the bypass, the blood can now circumvent or bypass the blockage, providing a new path to deliver oxygen and nutrients to the heart muscle. The grafts essentially function as new highways for blood transportation, circumventing the congested and blocked routes. But let's not forget about the other player in this field: stent placement. This procedure takes a less invasive approach to tackling coronary artery disease. Rather than creating a new route for blood flow, stent placement focuses on widening the existing pathway. Imagine a narrow tunnel that's barely passable. Stent placement is like inserting a sturdy scaffold within that tunnel to keep it open. The stent, a small mesh tube, is delivered to the narrowed artery via a catheter that's threaded through the patient's blood vessels. Once in place, the stent is expanded, pushing against the artery walls to hold them open. This restores blood flow to the heart muscle. Stents can be made of metal or a combination of metal and a special type of polymer. Some stents even slowly release medication to help prevent the artery from becoming blocked again, a condition known as restenosis. So, in a nutshell, while CABG creates new routes for blood flow, stent placement reinforces and widens the existing arterial pathway. Both procedures aim to restore effective blood flow to the heart, albeit through different strategies. On the other hand, stent placement involves inserting a small mesh tube called a stent into the narrowed artery to hold it open and restore blood flow to the heart muscle. Now that we understand the basic principles of these procedures, let's compare them in terms of effectiveness, risks, and recovery. When we speak of effectiveness, both coronary artery bypass grafting and stent placement have proven their merit in relieving symptoms of coronary artery disease and enhancing the heart's blood flow. However, certain research indicates that CABG may have a slight edge over stent placement in specific patient groups. This includes individuals with severe blockages or those living with diabetes. But remember, effectiveness can vary from patient to patient depending on various factors like overall health, the extent of the disease, and individual responses to treatment. Moving on to risks, it's important to remember that all surgical procedures carry inherent risks, and these two are no exception. CABG, by virtue of being more invasive, may have a higher risk of complications such as infection, bleeding, and even stroke. But it's not all smooth sailing with stent placement either. While it is less invasive, it carries its own unique risk known as stent thrombosis. This is when a blood clot forms inside the stent, posing a risk of blocking blood flow to the heart. So while no procedure is without its risks, being aware of potential complications can help you make an informed decision. Finally, let's delve into recovery. The road to recovery varies significantly between these two procedures. With CABG, you're looking at a longer hospital stay and a more extended period of rehabilitation. This is due to the invasive nature of the procedure and the physical toll it can take on the body. On the flip side, stent placement, being less invasive, generally leads to a quicker recovery time. This can be a significant factor for many patients as it allows them to return to their daily lives more swiftly. However, it's important to note that the recovery process is not just about the time it takes. It's also about how well you can adhere to post-procedure care instructions, the support you have at home, and how committed you are to cardiac rehabilitation. So there you have it. We've compared and contrasted CABG and stent placement in terms of their effectiveness, the risks involved, and what recovery looks like. As we've seen, both procedures have their pros and cons. CABG might be more effective for severe cases in patients with diabetes, but it comes with a higher risk of complications and a longer recovery time. Stent placement, on the other hand, is less invasive and offers a quicker recovery but carries the risk of stent thrombosis. In the end, the choice between CABG and stent placement is a decision to be made in consultation with your healthcare provider, taking into account your specific circumstances, medical history, and personal preferences. Recovery from CABG typically involves a longer hospital stay and a more extended period of rehabilitation compared to stent placement. However, some patients may prefer the less invasive nature of stent placement and the quicker recovery time it offers. So, how do you and your healthcare provider decide which treatment option is best for you? It's a question that warrants thoughtful consideration. Choosing between coronary artery bypass grafting and stent placement is not a one-size-fits-all decision. It is a choice that should be individualized based on a comprehensive evaluation of your unique health circumstances. Firstly, the severity of your coronary artery disease plays a pivotal role in this decision. Extensive or severe blockages, particularly in the left main coronary artery or multiple arteries, may lean towards CABG as the preferred option. Similarly, if you have diabetes or other conditions that could affect your heart's blood vessels, CABG may provide a more comprehensive solution. Conversely, if the blockages are less severe or confined to a single artery, stent placement might be a sufficient remedy. It's a less invasive procedure, which might be more suitable for those at a higher risk during surgery due to age or other health issues. Your lifestyle and personal preferences also come into play. Do you prefer a less invasive procedure with a quicker recovery time, even if it might mean a higher chance of needing another procedure in the future? Or would you rather opt for a more invasive surgery that could potentially offer a longer-lasting solution despite a more extended recovery period? These are questions only you can answer. Moreover, don't underestimate the power of a second opinion. It's perfectly okay to seek further advice if you're unsure about the first recommendation. Remember, this is your health and your decision. Finally, it's crucial to maintain an open line of communication with your healthcare provider. Discuss your concerns, ask questions, and ensure you fully understand the benefits and risks associated with each procedure. Your healthcare provider is there to guide you, but the final decision lies in your hands. Ultimately, the decision between CABG and stent placement should be made after thorough discussions with your healthcare provider, considering your individual circumstances and preferences. Make sure you've gathered all the facts, weighed the pros and cons, and made the decision that feels right for you. As we've seen, both coronary artery bypass grafting, or CABG, and stent placement are effective treatments for coronary artery disease, but they have different benefits and risks. CABG, a more invasive procedure, creates new routes for blood to flow to the heart by bypassing the blocked arteries. It's typically recommended for patients with severe blockages or multiple narrowings in the coronary arteries. Despite its effectiveness, it's important to note that CABG comes with a higher risk of complications such as infection, bleeding, and stroke, and it generally requires a longer recovery period with an extended stay in the hospital and a more intensive rehabilitation process. On the other hand, stent placement is less invasive, involving the insertion of a small mesh tube into the narrowed artery to restore blood flow. It is often preferred due to its quicker recovery time. However, it's not without its risks, as there's a possibility of stent thrombosis, where a blood clot forms inside the stent, blocking blood flow to the heart. The choice between CABG and stent placement isn't a one-size-fits-all decision. It depends on several factors, including the severity of your coronary artery disease, your overall health, your lifestyle, and your personal preferences. Each treatment has its strengths and weaknesses, and what works best for one person may not be the best choice for another. Therefore, it's crucial to have an open and honest discussion with your healthcare provider. Don't hesitate to ask questions about the benefits, risks, and recovery associated with each procedure. Your healthcare provider can provide personalized advice based on your medical history and current health status, helping you make an informed decision that's in your best interest. Remember, the most important thing is to have open and honest discussions with your healthcare provider about your treatment options. Thanks for watching, and we'll see you in the next video.